Hello, I'm Nissan Pilest. I'm a dermatologist in Irvine, California. And today we have with us one of our patients. Her name is Rebecca. And Rebecca is interested in getting some of these lines and wrinkles around her forehead and the areas between her brows, as well as her crow's feet, improved. So we'll discuss the use of Botox cosmetic with her. And as we can look at Rebecca's face, we'll ask her to frown in the middle. You will see that she is using her muscles in the between her brows a lot, and that's why she makes these wrinkles and lines. These wrinkles and lines in the middle, when she frowns here, are these two muscles in here. One is called the corrugator, which is one on the right, one on the left, and one is called the procerus. So what we do is we inject the start and the finish of the corrugator, and we put a little bit in the procerus, and this way we can go ahead and relax the muscles. There's no paralyzation being done here by Botox, as that word is using. It's essentially just relaxing the muscles. Then we'll ask her to bring her brows up. Act surprised. You will see that she's using the so-called frontalis muscle. This is a muscle that encompasses the entire forehead, as you can see is this muscle sheet. Now if we ask Rebecca to go ahead and smile, you'll see that she's using the crow's feet, the orbicularis muscle, so to speak, and she's making these 3-4 lines right here. And this is the orbicularis muscle. It's a very large muscle, and we inject only the areas around the crow's feet. So we will start in the crow's feet area. This is the 30 gauge needle. It's a very small needle. And in this area, we just insert the tip of the needle, and we inject about 4 units of Botox cosmetic in each one of these areas. So you can see some swelling here following the injection. This will go away within the next 30 minutes. So this is a little thicker muscle, so the patient feels a little bit when you inject. How are we doing?
Good.
And now we can start injecting her forehead. And again, in the forehead, we don't inject much. We inject very little, because we don't want the forehead to have any falling problems. We want everything to primarily just go up. So this is the total treatment. We do tell the patients that the improvement will start in about a couple of days, 2 to 3 days, sometimes sooner, and they look forward to have an excellent improvement within 7 days. This improvement would last about 90 days, sometimes a little shorter or longer. And as you do more treatments with this, the improvement would last longer and longer, and eventually you may actually have periods of 6 months that you will see the relaxation of these muscles. As far as aftercare, we tell the patient to use these muscles as much as she can for the next hour. So go ahead and frown and lift, and yeah. So we kind of have these muscles move so they can absorb this protein a little faster. We also tell them to be upright for about 4 hours, and if possible today not to go to the gym and do very heavy physical work.